FDA issues recall for 16 cinnamon brands due to high lead levels. Essential information. In a comprehensive public health advisory released by the U.S. Food and Drug Administration, FDA, 16 brands of ground cinnamon have been identified for having elevated lead levels. The FDA cautions that long-term exposure to lead, even in small amounts, poses significant health risks, particularly for children and at-risk populations. What occurred? The recall initiative commenced in March 2024, when the FDA initially published a safety alert regarding a selection of ground cinnamon products that were discovered to contain high lead concentrations. As further testing and state-level sampling progressed over the months, the FDA broadened the list of impacted products. In October 2025, the agency included additional brands such as HAETE, Roshni, Dura, and Weisswife in the alert. The current advisory encompasses 16 ground cinnamon products that, according to FDA-verified tests, surpass safe limits. Some of these products were voluntarily recalled by their manufacturers, while others remain under FDA advisement, particularly in cases where the agency was unable to contact the responsible company, such as HAETE, to facilitate recall actions. Why is lead in cinnamon a concern? There is no established safe level of lead exposure, especially for children. Lead acts as a neurotoxin that can hinder brain development, lower IQ, and lead to behavioral and learning difficulties. Lead builds up in the body, meaning that repeated ingestion, even of small contaminated quantities, can lead to increased blood lead levels over time. The FDA stresses that these cinnamon products, although not always explicitly marketed to children, are frequently utilized in foods that children consume, such as in baking, cereals, and spice blends. What should consumers do? Inspect your pantry. Identify ground cinnamon from the affected brands, including HAETE, Roshni, Dura, and Weisswife, and refrain from consuming them. The FDA recommends disposing of these items. Do not sell, serve, or include in food. If you are a retailer or restaurant, remove these products from your shelves and cease their use in recipes.